Let's change our thinking and start thinking of the heart in a different way, or the role of the cardiovascular system in a completely different way for exercise physiology. The heart's main role when it comes to exercise, it has two roles. We'll follow both roles. Its first role is to supply the muscles with a sufficient amount of blood when you're exercising. So once you start exercising, of course, you increase your muscles. You increase the blood flow to your muscles, and the more intense the exercise gets, the more blood your muscles demand because they need more oxygen and more metabolites and everything to operate at a high workload. And your heart tries to accomplish this by pushing more blood to your muscles by vasodilating those arteries going to your muscles. We talked about this in the other video where when you start exercising, you push more blood to your muscles. So that's the one goal of the heart, to supply as much blood as possible to maintain the intensity of whatever exercise you're doing. Now the second goal is to regulate blood pressure. Now this is a very important goal. Now, of course, when you start exercising, your arteries vasoconstrict, vasodilate. We all know our blood pressure raises when we start exercising. And it raises because blood pressure is how much blood is pressing against the walls of the arteries. So like you have an artery right here. This is the one going out of the heart or something, some artery carrying blood, and you have blood flow flying through the artery. Now, blood pressure is the pressure that the blood is pushing on the walls of the artery. Just like in a closed space, pressure is just all the blood pushing on the arteries, how much blood. And when you start exercising, there's much more blood flowing through the arteries. So blood pressure will be much greater. So of course, if you push more blood while you're exercising, your blood pressure will greatly increase. And now the heart is continuously vasoconstricting certain blood vessels to your less active organs and vasodilating other blood vessels to your active organs that need the blood. And it's doing all of this to do these two things: supply the muscles with blood, and also to regulate blood pressure. Because of course, the harder and harder you exercise, the more and more blood you'll be pushing through your veins and arteries, or arteries and veins, and your blood pressure will increase. So the whole time you're exercising, your heart is always vasoconstricting arteries and vasodilating to regulate your blood pressure. Because if your blood pressure raises too high, that's bad. You'll die. Well, I won't say you'll die, but it'll be very, very bad. Arteries will burst. It will not be good. Your blood pressure, and vice versa, it doesn't want to regulate blood pressure too strictly because it has to make sure that the muscles are getting the right amount of blood. So these are the two goals of the cardiovascular system. Now, eventually, this goal would win because this goal is, if this gets too high and you don't regulate your blood pressure, that can be a life-threatening problem. If your blood pressure gets way too high, you'll definitely die. So it'll choose regulating your blood pressure over supplying muscle with blood because that's not life-threatening. You just stop exercising. So that is the true reason why when you reach, I don't want to say when you always reach it, but when you're in shape, when you're an elite athlete, say, that's the true reason why you stop exercising. Because ultimately your body decides to regulate blood pressure more than decides to supply muscles with blood. So now we'll talk more about the redistribution of blood, which we're going to hit on the second video about how when you're at rest, most of the blood is going to your less active organs like your kidney. When you're resting, they're not really less active, but it goes to your kidneys. So play with some numbers. When you're at rest, you have blood flowing to your kidneys, your liver, your digestive tract, your GI, and we'll say your muscles. And of course, it also goes to your heart and your brain. Now, your muscles is probably only 20% of your blood flow. It's a very low amount because when you're at rest, you really don't need a lot of blood to your muscles. Now, the rest will say 30, 60, 80, 20. Okay, now, of course, I'm just making up numbers. These aren't really true numbers, but this is just showing. We'll say this is also 30 and say this is 10. Make it a little more better to see. Now, this is showing when you're at rest, most of your blood is going to more organs that aren't more like your kidney, liver, and your GI tract. So you really don't have much blood going to your muscles because you gotta face it, when you're resting, you really don't need a lot of blood to your muscles because they're not really active. Your body has other concerns to take care of. Now, when you start exercising, this ratio shifts, and this becomes somewhat like 80%, because you're shifting a lot more blood to your muscles, because your muscles need a lot more blood when you're exercising. And vice versa, let's say these all decrease to 5, 5, and 10, because my math is off. So 5, 5, 10. So they all decrease. And because they're less active when you're exercising, you really don't need a lot of blood to your kidneys when you're exercising or to your GI tract. Most of the blood will be going to your muscles. And this will happen because the arteries to your muscles will vasodilate, they'll get bigger, and they'll also lower blood pressure because you have an enclosed space like this. Got the pressure, now an enclosed space is getting bigger. So now the pressure will decrease. And then you vasoconstrict, so you increase your blood pressure going to these arteries. And that's like playing with the blood pressure. So that's one way. The other way, that's how the body neurologically, through vasoconstriction and vasodilation, controls blood pressure. And the other way is through the capillary sphincters. Now, this is the capillaries. It's a very zoomed in picture of the capillaries. This is where AV difference is, where like you have a certain amount of oxygen going through your arteries, like say usually 20 in the blood, and then you have a certain amount going out of the sphincters, and then you have a certain amount going back in your veins. And then what's going out in your sphincters is the AV difference. And now say 5 at rest. The reason why it's so low at rest and you're so inefficient at taking out oxygen is because this is the capillaries. It goes down and it breaks into many little sphincters, little paths. And we'll clear it to clear all this shit out. But it breaks down to many little paths. Now, when you're resting, these, they're called precapillary sphincters, like little doors, they'll close. Like this is closed, this is closed, this is closed, this is closed, this is closed. Okay, so now the blood only has the option to do this, to flow this way, and since I drew it weird, to flow that way. So blood doesn't, so your oxygen only comes out like right here, and right here. That's only, so using numbers, we'll say 20 units of oxygen go into the capillaries, only 5 come out, 15 leave. So your AV difference is 5. This is at rest. Now when you start exercising, all these sphincters open. Again, we'll clear that. All those sphincters open at rest, so now blood is doing this. Blood is flowing everywhere. And now since blood is flowing everywhere, you still have the same amount of blood entering. Since blood is flowing everywhere, much more oxygen has a chance to diffuse into the capillaries. Can you come back in a second?
Okay, I'm sorry.
Yeah. Oh, it's okay. So capillary has much more, it's housekeeping. So capillary has much more, chance to uptake oxygen because of the microcirculation of blood. Now it's important to know what causes this microcirculation, or autoregulation, what it's called. And it's called autoregulation because your capillaries is doing it by itself. It doesn't care what the hell the neural impulse is doing. It's choosing to open the sphincters completely by itself, based on cues in the body. And it does this based on byproducts of exercise. So you can memorize the byproducts, exactly what is opening the sphincters, or just know that each of these things that are relaxing the sphincters is a byproduct of exercise. And these are examples of lactic acid. That's a byproduct of exercise. So just abbreviate it as H, because that's also the universal thing as lactic acid. Hydrogen ion, lactic acid, it's acidic. Lactic acid is a byproduct of exercise, so whenever you have a lot of lactic acid in your blood, most likely you're exercising. So lactic acid will cause these sphincters to open, and that's a byproduct of exercise. Another one is heat. Now heat, of course, is a byproduct of exercise. If you start exercising, your skin's going to get very hot. You're going to have to dissipate heat, which is another reason why you increase your blood flow to your skin, so you can dissipate heat. More blood flow to your skin. Heat travels in blood, travels in everything. Heat is everywhere in your body. You'll dissipate heat. So more blood flow, the presence of a lot of heat will cause your sphincters to also relax. And if you have a presence of a lot of heat, most likely you're exercising. So it's a lot of these byproducts. The last one is CO2. If you have a lot of CO2 in your blood, most likely that means, if you have a lot of CO2, of course, that means you're inhaling a lot more than you're exhaling, because you inhale, you exhale CO2. If you're inhaling a lot more oxygen than you're exhaling, you would have a lot more CO2. I'm sorry, the other way around. If you're exhaling a lot more than you're inhaling, you have a lot of CO2 in your blood. So any of these byproducts will cause these sphincters to relax, and these are byproducts of exercise. So that's just saying if you have a high presence of these in your blood, most likely you're exercising and these sphincters will relax. Now we'll go over very quickly. Well, I guess, let's see if this is a good place to cover this in this video. I guess it makes sense in this video. So the very last thing is called venous return that we'll cover. Venous return is simply the amount of blood returning to your heart. So if you remember, you have your beautiful box of your heart, blood going out of your arteries, capillaries, got all those sphincters and whatnot, and going back to your veins. Your veins are very, very elastic. So what that means is they can carry a shit ton of blood. They're very large volume-wise. They can expand very, very wide to carry blood. Venous return is just how efficient your vein is at carrying blood to your heart. And when you start exercising, your venous return increases greatly. Now, venous return is what impacts VO2 the most and cardiac output the most. If you have higher venous return, you increase your cardiac output the most. And the reason is this is very simple to see. Since the heart's a closed loop, if you're bringing much more blood back to the heart because of venous return, that just means you have so much more blood to pump out. So closed loop, pump in a lot more blood, pump out a lot more blood. So venous return is very, very important. And this increases exponentially with exercise because you pump a lot more blood. Now this contributes the greatest increase, we'll say, to cardiac output. We'll use Q since that's most likely what he'll use. It increases the greatest return. Now the things that increase venous return are just 3 things you have to memorize. 3 things increase venous return. First one is the one-way valves. What that's just saying is the veins have one-way valves. Since they're going back to the heart, gravity wants to push blood back down. And these one-way valves cause the blood not to be able to push. So the valves, because blood can simply, what that's saying is the blood can only go one way towards the heart. The other thing is the muscle pump. And what this is saying, anytime you contract a muscle, regardless of whatever muscle it is, your finger or you're flexing your bicep, whatever. Anytime you contract your muscle, this vein recoils, which means it moves, and it recoils and pumps. And whenever this happens, you propel the blood to your heart more forcibly. So anytime you contract a muscle, you propel blood to your heart. So this is great because during exercise, you're obviously contracting muscles, and it will propel a shit ton of blood back to your heart. And the other one is a respiratory pump. And it's the same thing as a muscle pump. Every time you breathe, you're using the muscles of your diaphragm, but every time you breathe, it propels blood back to the heart. So every time you move, it propels blood. Every time you breathe, it propels blood, and also the one-way valves. All of these are working together to increase your venous return. A higher venous return means more blood propelling back to the heart. More blood back into the heart means you have a lot more blood to pump out, so ultimately you increase your cardiac output. So that kind of goes along with, well, that's a factor that also increases cardiac output. So that kind of goes along with, and also another, it's not really a big factor, is blood volume. It might be worth knowing. Blood volume is something that increases a lot with exercise. When you start exercising or when you're in shape, you increase your blood volume a lot. And thus you will, since you increase blood volume a lot with exercise, you'll increase cardiac output a lot. So blood volume is also another thing. So these are the main things that how the heart redistributes blood. Remember, its 2 goals is supply blood to the muscles so you can keep your muscles happy and meet with the demand of exercise. But its other goal is to regulate blood pressure. You don't want your blood pressure to get too high because, remember, you're increasing a shit ton of blood going to your muscles. But you don't want your blood pressure to get too high or get it too low. So you have to regulate both of those things. Ultimately, your heart will choose the greater one and regulate blood pressure since that's life-threatening if that gets too high, and you'll stop exercising. And then you'll regulate blood pressure, so then blood will stop flowing to your muscles. Okay, so that is the distribution of blood.